Hi everyone, and welcome back to OncoDaily. My name is Emma Ter-Azaryan, and I'm your host for today. Today, it's a great pleasure for me to introduce our guest, Dr. Aurora Mirabile. Hi, Dr. Mirabile. It's very nice to meet you. So before we start, I would like to briefly introduce Dr. Mirabile. She is the lead of head and neck cancer care in the division of otolaryngology at Raffaele Hospital. So first, I think our audience would love to hear about your background. Could you please tell us from the start till this day?
Yes, hello everyone, and thank you for inviting me. My name is Dr. Aurora Mirabile, and I'm a medical oncologist specialized in head and neck cancer care. My professional journey in this field began almost 20 years ago in 2005 when I trained at the National Cancer Institute of Milan with the mentorship of Professor Lisa Di Citra. Since then, I have dedicated my entire career to diagnosis, treatment, and scientific advance of head and neck oncology. Today, I work at Raffaele Hospital of Milan, where I'm the clinical lead for head and neck cancer care within the Department of Otolaryngology. And I am the organizational coordinator of Multidisciplinary Head and Neck Tumor Board in Cancer Center. This role is very meaningful for me because head and neck cancer patients often face challenges that go far beyond survival, challenges that involve speaking, chewing, swallowing, breathing, and sometimes even maintaining their sense of identity is a problem. This role is also to make sure that each person receive truly personalized care with their need at the center of every decision. And this is what guides my daily practice. My work combines clinical care, but also research, and I consider both essential. I treat patients with locally advanced disease in the curative setting, as well as those with metastatic cancer. Where findings the right balance between treatment efficacy and quality of life becomes crucial. Supportive care is also a fundamental part of my approach because I think that preserving function and dignity is just as important as treating the tumor. On the research side, I'm the principal investigator in several clinical trials, exploring new therapeutic strategies, including innovative agents, both in clinical, in biological and immunotherapy fields, as well as therapeutic HPV vaccine study. Contributing to development of new treatments and offering to the patients access to cutting-edge therapies is one of the most rewarding aspects of my work, in my opinion. And in summary, my mission is to bring together science, multidisciplinary collaboration, and humanistic medicine to offer head and neck cancer patients the best possible care, but always attentive to their quality of life.
Thank you. So I would love to talk about the last poster that you had, the clinical outcome in elderly head and neck cancer patients treated with concomitant cisplatin and radiotherapy. Could you please tell us more about it?
Yes, I'm really pleased and thankful for the opportunity to share the results of one of my study focusing on elderly patients with locally advanced head and neck squamous cellular carcinoma, because this is a population that remains largely underrepresented, usually in clinical trials, despite its growing clinical relevance. In this study, presented as a poster at ESMO Berlin 2025 and now published in Cancer with first name Chiara De Antoni, we analyze outcome of elderly treated with concomitant cisplatin and radiotherapy with curative or adjuvant intent. It was a prospective observational study on 170 patients, including 57 age 65 or older, compared with younger patients. What we found is that And with the careful selection and appropriate supportive care, elderly perform just as younger patients with comparable adherence, toxicity, and survival. In fact, all elderly completed radiotherapy and almost all received a full cisplatin, therapeutic cisplatin dose of at least 200 milligrams per square meter, confirming that the standard treatment remains feasible when guided by good performance status and geriatric assessment.
And I think we should also talk about your next publication about the retrospective trial on cetuximab plus radiotherapy in elderly patients with head and neck squamous cell cancer.
Yes, this is a second study about elderly patients because nevertheless we will know that not all patients are fit to cisplatin, and this is a study we published in Cancers this year, 2025, first name Molina Fasano, that focused on platinum-unfit elderly persons treated with cetuximab plus radiotherapy with curative intent across multiple Italian centers. Here too we observe excellent adherence because all patients completed treatment and with a median overall survival of about 58 months with manageable toxicity, which is really surprising. And as we already know, the typical cetuximab rush correlated with longer survival, confirming once again in this field its role as a marker of treatment response. Together, these two studies highlighted a more personalized and evidence-based approach to treat older patients with locally advanced head and neck cancer. On one hand, cisplatin radiotherapy for fit patients, on the other hand, cetuximab concomitant to radiotherapy for unfit. But both approaches show that chronological age is not a limiting factor. The patient functional status, comorbidity, present of caregiver and goals should drive our treatment decision. So the last and take-home message is treat the patients and not the age. Thank you.
Thank you so much, Dr. Mirabile. It was very nice to talk to you today and hear about some key insights from your poster and publication. Thank you.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.